What type of injury? Penetrating trauma. Now, penetrating trauma is trauma that has penetrated the body somehow, and there's different categories of this. We have penetrating trauma. Would a gunshot wound be penetrating trauma?
Sure.
Yeah, what about somebody taking a knife and just stabbing you with it?
Yes.
Is it different?
Yes.
Are they both potentially lethal?
Yes.
Yeah. So you want to look at, hey, if you shot with a gun, what was the caliber of the weapon? How far away was it? Was it point blank or was it 2.5 miles away? Was it a shotgun or was it a .22 or a pellet gun? Was it a knife? Was it a little paring knife or was it a Bowie knife? Those things are important to know. Motor vehicle crashes. The majority of what you'll probably see is going to be motor vehicle crashes. You'll see a lot of those because, one, you think you'll see a lot of motor vehicle crashes. Huh?
Right. A lot of people driving around.
A lot of people drive, right? It's just the odds in Vegas, right? It's just a crapshoot every time you get in the car if you're going to be in a wreck or not, right? Some things you have control over, some things you don't. So with our motor vehicle crashes, we want to look at the amount of force that's applied to the body. And how do we know that? The speed of the vehicle, yeah. The speed and the size of the vehicle. Mainly, though, the most important factor is the speed. We want to look at the body part that was most likely affected. If you see spider web on the windshield, what could that be indicated of? Head hitting the windshield, right? Is that bad?
Yeah.
Windshield's pretty hard. What about if you see the steering wheel is what we call tacoed? Anybody here eat tacos? I love tacos. Anybody here love tacos?
Sure.
I do. I love tacos. You take a hard shell taco, what's it look like? Kind of like that, right? You ever seen a steering wheel that's bent like a taco shell? Yeah, it happens where the legs bend it and the head, and you go over it like this, and it just bends the steering wheel over. How much force do you think was applied in that? A lot. So there's a lot of potential there for injury, right? You also will see the dashboard will have indentions in it where their knees go into the dash. One thing too that is subtle, look for the rear view mirror. So once that rear view mirror is knocked off, guess how it got knocked off? Yeah. And where's the rear view mirror at? So how far did that patient travel to hit it? Pretty far. What type of accident were they in? Is it a sustained accident? We have a sustained accident where forces are continually applied to the body. For instance, a rollover, where the car rolls over 3 or 4 times. Every time that car rolls and that patient's in there, every time they hit something, that's forces being applied to them. Not only that, how many people here drive an immaculately clean car with nothing else in it? With nothing in it at all? Anybody? No soda cans?
I used to. None of them.
No tennis shoes, no books, no gross, nothing in there, you know? I guarantee you, at some point, if you go look at my truck, it's like a rolling death zone, okay? If we're in a rollover, you may be in trouble. So, all those items that's in there, guess what they become? Little missiles that can hit you and can hit your patient. And those are hitting your patients, causing what? Further injury. That's why in your ambulance, in the back, it is very dangerous because think of everything that is not secured down if you're in an accident, if you're in the back of it. So, those are things you're wanting to look at. Now, one thing that it doesn't take much of a rocket science to figure out, but you really may not think about it, but the driver is at the highest risk. Because there's more things for them to hit. Closer. The steering wheel causes havoc on the body. Then the front passenger. The safest place to be is the rear passenger in the middle. That's the safest place. And did anybody not know that unrestrained passengers are at the highest risk?
Yes.
Yeah, they're very, yeah, that's not a good thing. All right, so falls. This is another mechanism of injury that we want to think about. You know, it's not the fall that gets you, right?
Sudden stop.
Sudden stop at the end. Fall can be fun, as long as the parachute opens. So what we want to look at here is the distance fallen and the type of surface that you landed on. It's a big difference if you land on concrete versus if you landed on fresh mulch. We want to look at the body area that was impacted first. There's a big difference if you landed feet first versus if you took a head first dive, right? Anytime you have a fall over 3 times the patient's height, that could be dangerous for them, okay? So you want to suspect a lot more injury for 3 times the patient's height. In a pediatric patient, it's 2 times the patient's height. Gunshot wounds and stab wounds. Gunshot wounds and stab wounds. Now, I know we talked about penetrating trauma a little earlier. And gunshot wounds and stab wounds are penetrating trauma, but we typically like to classify these by themselves as well because there's other penetrating things. You know, like sticks, swords, I guess that'd be a knife, but fence posts. I've had people in car wrecks had fence posts impaled in their chest. Had people falling out of deer stands and had limbs impaled in them. The problem with gunshot wounds and stab wounds is sometimes it may be difficult to find them. Those entry wounds can leave very small holes. But once that bullet gets inside you, it can cause a lot of damage. It's not always like the movies. Because like on TV, when somebody's shot, what happens? Blood goes everywhere, right? In reality, sometimes you see very little blood. It'll all be internal. You don't always have an exit wound, but sometimes you do. And your entry wound is always smaller than the exit. The exit wound is bigger. Doesn't mean it's a lot bigger. Sometimes you may have a little entry wound that's about the size of your pinky, and then have an exit wound that's the size of a silver dollar. It's different. So, stab injuries exert little force, but it can be lethal because because you can just push them through. You know, like a bulletproof vest, you can have a bulletproof vest that'll stop an M16 round, but it won't stop a knife. All right, so medical patients. In our medical patients, we have to try to figure out the nature of illness. And whenever we think about nature of illness, we're going to try to figure this out based off the patient's chief complaint. If a patient comes to you, or you come to a patient and they're complaining of difficulty breathing, well then you can start formulating your nature of illness around complaints that would associate with difficulty breathing. If they're complaining of back pain, well then you would try to think of things that may have to do with chronic back pain. Now that we do have similarities between mechanism of injury and nature of illness. We both have to look for clues. I'm going to tell you that the nature of illness is a little more difficult because it could be a lot more broad. But the way I do it, I just classify it. Is it a respiratory problem? Is it a cardiac problem? Is it a metabolic problem? Is it a neurological problem? And so on. Getting information about the nature of illness, you're going to talk to the patient, family, or bystanders and use your senses. Sense of touch, smell, sometimes the GI bleeds stink. No, GI bleeds. Gastrointestinal bleeds. When you walk in the room, you'll know them. So, check for these clues. It's going to hone you in on what's going on. Y'all need a break? Okay. Y'all good? Y'all sure are a lively group. All right, standard precautions. All right, we're going to wear personal protective equipment. And this right here is an example. We've got some personal protective equipment here. We've got a gown and gloves, a mask, and glasses on. This is also body substance isolation, right? Because this will isolate you from certain body substances. Now, we're going to adapt this to the task at hand. Now, I will see things, because you'll probably see a question on what is the appropriate PPE to wear when responding to a patient who is known to have HIV. And the answers will include, one will say, glove. And the patient with HIV just has a fever. Just complaining of a fever. And the answer will include gloves is A. B. Gloves, gown, and goggles. C. Gloves, gown, goggles, and a mask. D. None of the above.
C.
A.
It's A. Gloves, because you should be assuming all your patients have HIV. Just be glad you know this one does. You don't have to dress up like this just because the patient has HIV and they have a fever. Now, if they've been shot 3 times in the chest, then you should wear this. And there's blood going everywhere, right? That's what you should wear. But you should wear that too it doesn't matter. You should wear it anyway, right? Yes, sir.
How do you already know that the patient has HIV?
Because maybe you've gone out on them 4 or 5 times. You know the address. Because people that have chronic problems like that, you tend to get to know. But you cannot you don't treat people different. Remember I told you a long time ago, we don't do what? We don't draw lines and start putting people on one side or the other, do we? You don't. It's appropriate just to wear the gloves. Because all this other stuff's not going to help you anymore. Unless there's squirting blood everywhere. But if they're squirting blood everywhere, it doesn't matter if they have HIV. You should wear it anyway. It shouldn't be because they have HIV. You should wear it because they're squirting blood everywhere. So standard precaution has been developed for helping us in dealing with objects, blood, body fluids, and other potential exposure risk of communicable diseases. And each place that you work at, wherever you work at, is going to have a procedure on how you are going to respond to potential incidents where you need certain PPE. Most protocols will say on every call you will wear gloves. If they're squirting blood, you will wear gloves and goggles and potentially a gown. If it's childbirth, you will wear this. Childbirth tends to be messy. Okay, so when you step out of your vehicle, you need to have your standard precautions in place. At minimum, gloves. One thing I want you to note, that guys and ladies that wear glasses, your glasses, like guys in here that have glasses on, that is not enough to protect you. From the top and the sides are not protected. You need to wear appropriate ones. You can wear this, and guess why they're so big? So they'll fit over your glasses.